So eyelid bumps come in many forms, including styes, chalazia, xanthelasma, and milia. They could be white, red, or yellow. They don't usually cause problems, but some can be a sign of a more serious problem. So in today's video, we'll dive into what exactly is that pimple on your eyelid and what to do next. Welcome back to Eye School with me, Dr. D, where I teach you about products and treatments related to dry eye syndrome and eye beauty so you can have healthy, beautiful, comfortable eyes. And before we get started, give a little love tap on that subscribe button to stay up to date with all the latest tips and tricks I have for you. So there are several types of bumps that can occur on a person's eyelid, and here's how you can kind of tell what kind of eyelid bump you might have. Of course, I always recommend seeing a doctor if you have a concerning bump, especially if it's come up really quickly or is painful to you. But this is intended to be a guide to kind of help you decide what sort of pimple you have on your eyelid. So first, let's start with probably the most common. I see these almost every day, definitely every week. A stye. So this is just the common name. It's actually called a hordeolum, and you can have an external hordeolum, which occurs more outward on the lid, or an internal hordeolum, which is occurring within the meibomian gland. Now, a stye is gonna look like a pimple or a blister. Usually it's gonna be along the outer rim of your eyelid. It can be red and painful to the touch. In contrast, a chalazion or chalazia, if there's more than one, will often grow on the underside of your eyelid, behind your eyelashes, or midway up your eyelid. So here's the thing about chalazia. Chalazia don't tend to be hot, they don't tend to be as red, and they can look like a stye, but they usually don't hurt like a stye does. And actually, you can have a chalazion form after you've had a stye. So let's say you have an internal hordeolum or stye that resolves in terms of the bacterial infection. Now you have inflammatory debris left over, and that bump is called a chalazion. So actually a stye can turn into a chalazion. Chalazia sometimes have to be cut out, actually. So there's several approaches to getting rid of these, which I think we'll get into a little bit later. But essentially, a stye typically needs to be treated, right? Because a stye is going to be hot and red and painful, and it's infected. And so we're treating that with antibiotic drops and sometimes even oral antibiotics to avoid having preseptal cellulitis if we think that it's spreading along the skin and turning into a skin infection. Versus a chalazia is kind of the already dried up, hardened, inflammatory debris within that gland. And so now you have to kind of treat that a little bit differently. You might be able to make a little bit of progress on a chalazion by using a hot compress, but oftentimes we need to intervene. So in my clinic, I actually intervene using light therapies like low-level light therapy, intense pulse light, and I have made many videos about these things, which we'll link above, but those are treatments we use also in our dry eye patients. And I've even had success in my patients who have recurrent styes, recurrent chalazia, and I've had to get them cut out before. I'll do IPL and prevent those patients from having more of these occurrences. You can also treat an active stye with IPL. In fact, I've done that quite frequently. You can get styes to go away very, very quickly as compared to trying to treat with the typical topical antibiotics and that sort of thing. Now there's injectables too. You can inject a stye. Typically that's done with steroid injections, also with mixed results, and then you can have it cut out. So if you're watching this video, you may have had a chalazia cut out before. You have to flip over your upper eyelid if that's where it is, make an incision, and kind of just get all of that inflammatory debris out. Now we can contrast those two bumps around the eyelids with xanthelasma. So xanthelasma are a little bit different. They're soft yellow collections of plaque under your skin. So they're usually kind of in this inner canthus towards your nose, and they have a very distinct appearance. I'll put an example up here on the screen, but xanthelasma are often in younger folks the result of high cholesterol. So anybody under the age of somewhere around 40 to 50 with showing up with xanthelasma, I'm gonna recommend we get a lipid panel, a cholesterol profile, and kind of see what that looks like before we just write it off as normal aging. Now, sometimes they run in families. I've definitely seen folks that get them younger than we would expect because it tends to run in the family. And then finally, of course, these can just collect under your skin as you get older. Now, xanthelasma can also be removed by an oculoplastic surgeon. So if you see an optometrist or general ophthalmologist, you can ask for a referral, and they can have an oculoplastic surgeon remove your xanthelasma. Next, we have a milium or milia. It's a tiny white little cyst. So these are really, really common. They're common in children. I actually see them in adults a lot as well. Some people will call them oil seeds or milk spots. And milia can kind of pop up. I've seen it with patients that use a lot of occlusive skincare. We'll see a lot of milia in those patients, especially like Vaseline around the eyes. And those can be fairly easily removed as well. Now, I've gone over the most common sort of benign eyelid bumps, lumps and bumps, but there are certainly a number of other eyelid bumps that can occur. You can have almost any type of cancer on your eyelid. You can commonly, we see basal cell carcinomas, sarcomas, not as common, but you can have a nevus on your eyelid, which is just sort of a freckle, and those have to be watched for melanoma. There are a ton of other eyelid bumps that you can have in that area. And so those first ones I talked about are relatively benign and common. If your eyelid bumps have different symptoms, it's incredibly important to get them checked out because you may be having a basal cell carcinoma or melanoma on your eyelid, and treatment expediency is key, right? So getting that off and biopsied and treated is going to be really, really important. So commonly eyelid bumps in terms of symptoms will have, swelling, tenderness, redness, irritation. Even if you have a huge chalazia or stye, you can get blurry vision from that. The thing to watch out for are lumps and bumps that don't go away, that worsen over time, that change color. Even as an eye doctor, when we see chalazia or hordeolums that seem to just occur and occur and occur in the same gland all the time, you start to think about maybe getting that cultured and maybe, or beyond cultured, but having a biopsy done and finding out what that's made of. Like, why is it recurring all the time? So pretty normal to have some of these lumps and bumps, but if they're acting out of the ordinary, occurring over and over, not going away, not responding to treatment, that would be a time to think about going in and maybe having it biopsied. So we've talked a little bit about each of these conditions and why they might occur and when you might want to get them tested a little bit further. Let's dive in just a little bit deeper. So if that's all you wanted to know, just hit the like button and you can move on to another video. But we're going to dive into each of these a little bit more. So let's talk about stye and chalazion. So a stye is coming from an infection in an eyelid oil gland or an eyelash follicle. Usually those eyelash follicle ones will be the external hordeolums, the eyelid oil gland, the meibomian gland. Whole video about that here. Those are internal hordeolums. And you can get a stye from stress, hormonal changes, touching your eyelid with dirty hands, but you can also get it from sharing makeup or changing makeup or just kind of coming into contact with something in the environment. It can be tough. I've got a patient of mine that runs marathons and has challenges every time his mileage goes up, and I think that's because of all the sweat sort of moving around, right? So a lot of different things can cause you to have a stye. It's not just dirty hands, but you definitely want to think about, all right, did I borrow someone's makeup? Have I been using my makeup a little too long? Now, a chalazion happens when a tiny part of your eyelid, that's the meibomian gland again, becomes blocked. You can also get a chalazion from a stye that's no longer infected but has left hardened material stuck in a gland. We talked about that a little bit before. But a chalazion is still telling you that there's something going on with those meibomian glands and we don't necessarily have the oil secretions we want to have. And so if your doctor has infrared imaging available, I think it's really a good option to get infrared imaging and say, okay, what's going on with the rest of my glands? The other thing is that meibomian glands, we tend to see them change even with contact lens wear. So maybe you don't wear makeup and you always wash your hands and you're really diligent about everything and you're going, why am I getting these? Wearing contact lenses can cause meibomian gland dysfunction as well. In fact, it's the #1 reason for established contact lens wearers to drop out of their contact lenses. And so if you've worn contacts since you were a kid, you may also consider getting your glands imaged and seeing how they look. Now, blepharitis is a condition that causes your eyelids to become inflamed, and that often gets linked to styes and chalazia because you have redness And this inflammation, extra dead skin cells at the base of your lashes, and so that can lead to these infections within the glands that are just adjacent. Rosacea is a skin condition that's linked to these as well. In rosacea, we see patients with abnormal sebum production and abnormal meibomian glands, and so that can lead to dry eye, but it can also lead to these styes and chalazia. And I touched on this earlier, but skin cancers can also cause styes and chalazia, although it's really, really rare. If you were to have a stye or chalazia happening in the exact same spot every time, that's a reason to be suspicious and dig further. And then xanthelasma, it can be a sign of cholesterol problems. They're common in people who have liver disorders like primary biliary cirrhosis. So they can also be common in skin conditions like erythroderma dermatosis and contact dermatitis. Now, milia happen when dead skin cells get trapped under your skin. And skin damage can also cause secondary or traumatic milia. So you can see milia popping up in areas where you've had skin damage before, whether that was trauma, an injury, a skin damage due to like products you're using or things like that. So in terms of how long eyelid pimples will last, styes and chalazia usually clear up on their own in just a few weeks. Milia also usually go away on their own. I would not advise you to try to pop or remove those either. If they have been hanging out for a while, you can get those removed by somebody trained to do so. So here's 7 steps to eliminate a pimple on your eyelid. So my first rule is never ever poke it, squeeze it, or try to pop it. Popping a stye or a chalazion could cause a more serious problem. You could cause backward pressure in that meibomian gland, sending the infection backward. It could really result in more of the glands becoming infected as that material is excreted. It could result in a preseptal cellulitis, meaning a skin condition or skin infection of the eyelid. And then of course we have to be concerned about that moving backward behind the orbital septum. So the reason you can't get a contact lens lost in your brain, and the reason you can't, you normally don't have eye infections that turn into brain infections, is the orbital septum. But there's an instance in which, preseptal cellulitis can turn into an orbital cellulitis, and that is very concerning. So do not pop, squeeze, or try, poke your styes. Don't poke a stye. Don't poke a bear. Don't poke a stye. Next, I would recommend putting a warm, damp cloth on your eye several times a day. I really love Brooder masks, Optase masks. Even the USB powered warm compresses would be great for this. You can massage the swollen area gently to help drain the clogged gland. But remember, very, very gently. We don't want to squeeze. I'm also okay with you using some exfoliating treatments if your skin can take it. It really depends. But if you have some actives in your skincare, like a salicylic acid that will help sort of exfoliate that area, that's a reasonable thing to use if you have it on hand. It's also reasonable to use eyelid scrubs. So I love the ones from the Hydrate brand, from the Ziegler's brand. That really, really helps in cleansing the area. You can also cleanse around the area with the tea tree foaming cleanser. I would also recommend going without any makeup or contact lenses until the eyelid has healed. Those can hold the bacteria that cause the infection. Or they may become contaminated by bacteria in the area due to the infection. So you want to make sure you're cleaning and disinfecting your lenses, maybe even switching to new ones truly if that's an option for you. But don't forget the accessories too. Don't forget the case. You've got to get that clean as well. And once the bump drains, keep the area clean and keep your hands away from your eyes as much as you can. And if this has gone on for a little while now, if the bump is not draining or clearing, go to the doctor, because we can help you and get that thing gone so quickly. And sometimes people come to us sort of, I wouldn't say too late, but when the stye's been going on a while, and now we're dealing with much more inflammatory debris to clear, and it's much harder to totally get rid of that chalazia. Now, if you have xanthelasma, I mentioned this before, but your doctor should check your cholesterol levels. They might work with you on dietary changes. Your optometrist or ophthalmologist might coordinate with your primary care doctor to get you a medication like a statin drug. These may help shrink the xanthelasma, but they won't go away on their own. You may want to have those removed. Doctors will freeze them or cut them, sometimes even using lasers or chemicals. Again, this is going to be an oculoplastic specialist that can really guide you in in that regard. If you do have a large painful stye or chalazion that doesn't go away, please see an eye doctor, especially a dry eye specialist. They may prescribe an antibiotic to clear it up. Any optometrist or ophthalmologist will do that. But in more severe cases, or if you need that thing gone, like let's say you're getting married in a couple days or something, like this thing's got to go, then we can do IPL to get it gone quickly. We can use other light therapies like low-level light therapy. And then in severe cases, doctors can drain the bump or even do a steroid injection to help it heal. If the bump's an unusual color or seems to be changing color or shape, again, see your doctor right away because we can't ignore the fact that some lumps and bumps, even on the eyelid, can be cancer. If you have a lot of milia or if you're worried about how they look, your doctor can remove those too. And if your baby has milia that don't go away within 3 months, definitely talk to your doctor about that. If you do get a lot of styes because of blepharitis, your doctor can give you antibiotic steroid ointments. They can give you lid cleansing routines. We can even do other therapies like IPL and low-level light therapy, and we'll watch you closely for side effects of like steroid use if we're having to put you on those types of medications. Xanthelasma will come back in up to 40% of people who have them surgically removed, and that number is higher in people who've had more than one removal. And finally, regarding milia, trying to scrape them off, you could cause scarring. So we definitely want you to see a doctor for that. All right, so eyelid bump prevention. How do you lower your odds of getting a stye or a chalazion? Always, 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 without exception, forever and always, take off your eye makeup before you go to bed. Non-negotiable. We're not even gonna talk about it. We're gonna do it, and we're gonna move on. Number 2, another non-negotiable, disinfect your contact lenses. Take good care of your contacts, take good care of the case. Wash your hands before putting in your contacts or touching your eyes. And the best way to prevent xanthelasma may be to treat your other health conditions linked to them. As far as milia, there's no one way to keep from getting them. You might make them less likely by protecting your skin from the sun, avoid heavy creams and Vaseline, and exfoliate to get rid of dead skin cells so that they don't accumulate in those milia. All right, so we've covered the waterfront in terms of eyelid pimples, and we've also talked about the fact that if they're acting weird on you, you should probably go see somebody so you can get them biopsied. But let me know about your experiences and questions about my 7 steps to eliminate the pimple on your eyelid. Make sure to leave a comment below about your experience with styes and chalazia. I love it when you guys share your experiences. That's gonna be it for today's iSchool. Class is dismissed. I'll see you next time.